This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about 4 of the most common causes of hip pain. If you like this video, we put out new content weekly, so please like and subscribe. So hip pain, 4 of the most common reasons. We'll kind of start from most common to generally least common. There's obviously more than 4 things that can cause hip pain, but here are some of the most common. One is called hip bursitis. This is when you have pain on the outside of your hip. So if you were to push on the outside of your hip, right on the side, it causes pain. You'll notice it more when you've been walking on uneven surfaces or you've been walking for a long time. And what that is the outside of your hip bone called the greater trochanter, and it basically rubs on your IT band and it kind of creates a bursitis in that area called greater trochanteric bursitis. Usually the pain will be pinpoint right there. Generally speaking, physical therapy and a steroid injection are great ways to just kind of take care of it permanently. Rarely, if ever, is surgery needed. A second common cause for hip pain is when you have sort of pain in the groin, kind of in the front of the groin. And that can be a few different things. So we'll start off kind of sort of superficial and go deeper. So one of them is psoas irritation. So your psoas muscle is the muscle that allows you kind of to lift your hip upwards. And sometimes that can get irritated and it sits right over the hip capsule joint. And sometimes it can actually even click or pop. So if you notice you have pain in your groin, maybe you stand up funny and it like clicks or pops, it's probably psoas irritation. It can be other things, but probably psoas irritation. The best thing to do for that is just sort of stretch it. There's physical therapy exercises when you can stretch it. Rarely will inject it. Surgery is not really indicated. People used to release it, but it turns out that doesn't really do well. It's a pretty important tendon. But if you have clicking or popping and you're on the younger side and it's in the front of your hip, chances are it's probably psoas irritation. Another thing that can cause hip joint pain or hip growing pain is a labral tear. So this is the hip is surrounded by something called a labrum, which is sort of a rubbery layer that keeps the hip in the socket, and sometimes that'll get torn. Usually it's through sports, or most people that have it torn are generally speaking athletes. That'll be growing pain, but that doesn't really respond to stretching like you do with psoas. And if you kind of jam your hip up and in, you'll feel pain there. In that case, sometimes you can calm it down with an injection, but a lot of times if it's really symptomatic, the only way to fix that is just to repair the labrum arthroscopically. So someone who does hip scopes would have to do that for you. The last reason, and this is actually probably a more common reason than some of the other ones, is hip arthritis. So this is generally a population of people who have hip arthritis are generally older. How does it sort of manifest? It's pain right in the groin. Worse, when you get up in the morning, you'll notice that putting your shoes on or putting your socks on is just excruciating. So with hip arthritis, you can inject it, you can do physical therapy, but honestly, if it's really bad, sometimes the only thing that really works is a surgery of a hip replacement. If you want to tell if you have hip arthritis, an x-ray is a really easy way to tell that, and it's pretty simple to do. So those are 4 main common causes for hip pain. One is greater trochanteric bursitis on the outside of your hip. Next one is psoas irritation on the front of your hip and the groin. The next one is labral tear in the groin as well, and hip arthritis, which usually manifests as growing pain. So I hope I was able to answer some of your questions about the common causes of hip pain. If you have any questions I did not answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you medical advice over YouTube. And again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.